alcohol abuse is costing £27 billion a year in England. We're going to read into this exclusive from The Guardian, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with an exclusive from The Guardian with the headline of alcohol abuse is costing £27 billion a year in England. The exclusive revealed that experts call for higher taxes and tougher regulation as research shows costs to the NHS and other public service and the economy. Guys, while you're here, make sure you hit the like button and share it across social media so others are notified of this video. £27 billion a year, guys. That's just alcohol abuse. And in one country, it's a staggering amount of money that is being wasted here, and it shows that whatever action plans that the Conservative government have done the last 14 years has really not been enough to help deal with those who are suffering from alcohol abuse, because clearly there's not been enough to address it, and in fact it's the exact opposite, that it's gotten worse. It's costing time and money on the NHS, causing public disorder on public like buses and trains and whatnot for the disorder. And in terms of the economy, you know, that £27 billion could go somewhere else, you know, in total. And I think that this increase also plays in a part, not just cost of living crisis, but also the austerity as well, because when people don't have like the communities and some of the communities that have gone, or when people don't have some of the services that they've had before, when some people aren't able to have to reach out to the services that they've had before, some people turn to alcohol, or in some cases, rare cases, where they turn back to alcohol after beating it, after going sober, because they have nothing else. And alcohol, of course, is a luxury for people to have, but it also can be something that, you know, helps you drown out your sorrows and your pains and whatnot as well to some people. And while there is while we have a society out there that is pretty content and doesn't drink too much and is pretty careful when it comes to alcohol, we also have a situation where too much of it is being abused. We do have, I would say, there is a proportion of England who just drink until they drop, and while it may seem like a bit funny and whatnot on the outside, what it could do is really detriment these people, and it causes people to get violent, get disruptive, and that all plays a part in alcohol abuse, because it then creates more work for the police to deal with these situations, creates an incident that doesn't need to be created, it's just more frustration, and then obviously you stack this on top of a cost of living crisis, you stack this on top of the austerity that we've gone through, and how just life itself has gotten worse, I would feel, after the last 14 years. You know, the changes of less pubs over the last 20 years or so, ever since the smoking ban came into place as well. You know, we've seen a lot of pubs disappear from our high streets. There are still pubs out there, but we've seen a lot of them disappear out there. So a lot of people, instead of drinking and while socializing with friends and family, a lot of people are just buying cans and whatnot from the local shops or supermarkets now, and are just drinking till they drop in their homes as well, as opposed to drinking and socializing at the same time, because at least, if you're doing that, there's at least people there to pick you up. Whereas if you do it in your own home alone, there's not really anybody there for you if you go too far, which sadly could lead to your loss of your own life. It's a very rare occasion, but it can happen as well. But it's obviously not good for your mental state as well. So yeah, there's a lot of factors into this, into costing this £27 billion a year, and a lot of things need to be done to address these issues. And I'm sure there's more things that I haven't mentioned just on that, but some of these ideas, and obviously when people outside of the UK, people outside of England, when they look at England fans, when they come to sporting events and whatnot, they're considered troublemakers. Oh, they're going to cause trouble, they're going to drink and all that. Because unfortunately, there is a section of people, a section of English society, unfortunately, and I'm going to say a section, not all of us, because I don't feel that's right. A section of England society who feels the need that everywhere they go to literally drink until they drop, because alcohol costs so much cheaper whenever they go somewhere else. And it paints us as a bad picture, unfortunately. So the cost of alcohol abuse is laid bare in a new study that shows £27 billion a year is being spent on England on the health and social harms of drinking. The research found that an extra burden on the NHS, social care, the criminal justice system and the labour market cost at least 37% more than in 2003, when comparable research by the Cabinet Office estimate the cost of between 18.5 billion and 20 billion. And that could even be actually higher, because doesn't factor in maybe as many reports out there as we know as well. So it could even be higher than this for all we know. Using the same methodology, the Institute of Alcohol Studies, the IAS, calculated that alcohol cost to the health service £4.9 billion a year, of which more than £3 billion was alcohol-related A&E visits and hospital admissions. Yeah, because people like to drink till they drop, and it becomes a problem for the A&Es. Official figures released in April show that a record 10,048 people in 2022 died from alcohol-specific cases, the highest level since record began in 2001. Just 2 years ago, we had over 10,000 people die from alcohol-specific causes. Drinking has been linked to numerous health conditions involving 7 types of cancer: cardiovascular disease, cirrhosis, stroke, and digestive problems. Yeah, all these things will play a factor into that, without a doubt. Alcohol also has a much wider impact on individuals and society. The IAS study put the cost of alcohol to the criminal justice system at $14.6 billion, with more than 4 million alcohol-related crimes. Social service spent nearly £3 billion a year dealing with the impact of drinking on individuals and families. And by the way, just before I go any further, I've covered, obviously, not too long ago about the smoking ban, and about, why they say that smoking is a detriment to the health and all that kind of thing. Well, so is alcohol, and yet we don't categorize alcohol anywhere near this. We don't seem to categorize alcohol as the same problem as smoking, and yet here we are looking to ban smoking completely outright. To me, I don't see why why do we see alcohol differently from smoking? Now, I'm not saying we should outright ban drinking. No, I'm not saying that. But should we not be doing more here? In the wider economy, the study estimates that $1 billion is lost as a result of unemployment due to alcohol use, and nearly $4 billion through lost productivity. I've always said that more needs to be done to make it. They need to make it more difficult for people to get their hands on alcohol. They need to make it. It needs to cost more. It needs to cost more in supermarkets and in shops, and it needs to be cheaper in pubs and restaurants. Now, how you do that, I'm not sure, but it needs to be. It needs to be, from my opinion, it needs to be done in such a way that it can actually help the pubs and restaurant business more, and it also forces people to socialise more as well. The costs of society are not even felt, the ISS found, with the per capita impact of drinking highest in the northeast and the lowest in the southwest. The cost of population, the average cost of head per alcohol harm is £485 a year, rising to £562 a year for living in the northeast. The Commons Health and Social Care Select Committee is due to hear evidence on alcohol harms next week as part of its inquiry into preventing ill health from drinking, smoking, drugs and gambling. Dr. Katherine Severi, the ISF chief executive, said the data was compelling. As a country, we cannot afford to sit back and do nothing. The government should develop a comprehensive alcohol strategy to tackle this rise in harm. Which would have a knock-on effect in reducing financial burden too, she said. Yeah, it would also have a massive financial burden, especially, like I said, cost of living crisis. People are turning to alcohol. If alcohol was not a factor, that could save people money. It makes total logical sense from the doctor there. So this graph here, this is a source from the Office of National Statistics. The data shows deaths as a direct consequence of alcohol related rather than deaths attributed to alcohol by year of registration here. So it's more than 10,000 people in the UK died as a direct result of alcohol in 2022. So you can see there from 2001 to 2022 that this is recorded, and as you can see from 2001 there has been a slow rise. It peaked at about 2008 there, and then there was from 2008 there was quite a decline till around about 2003. It looks like there from the graph. And then pretty much from 2003 onwards, it's been a steady decline. And then it looks like there from about 2018, I think I would say, from 2018 or so, is when there was a massive boom, an increase in alcohol, and it's just gone extremely up since then. From pretty much from 2018, there was a massive spike there, according to their numbers. Responding to the figures, clinicians and public health experts reiterate the need to make alcohol more expensive and harder for young people to buy, and to make it easier for local authorities to control its availability in their areas. Dr. Sarah Clark, the president of the Royal College of Physicians, said urgent action is needed to tackle the harm caused by alcohol. The cost to individuals and society is huge and growing year on year. We are calling for the increased duty on alcohol, health warnings and nutritional information on labelling and restrictions on alcohol marketing. This will significantly improve health conditions and reduce the strain on the NHS workforce currently facing overwhelming demand. Yeah, and if you want to help, it's also playing a factor into the NHS as well. So Robert Williams, the Chief Executive of the Royal Society of Public Health, said alcohol remains one of the biggest risk factors for preventable diseases. There are a range of public health interventions that could help minimise alcohol-related harm. These include measures like minimum unit pricing and empowering local leaders to restrict advertising, he said. Yeah, all these kind of things we can do to help mitigate it. Alice Wiseman, the Vice Chairman of the Association of Directors of Public Health, also called for minimum pricing unit and tougher regulation. The alcohol industry marketing machine needs to be regulated much more rigorously so that they are no longer bombarded with messages that alcohol is safe and attractive products, she said. What's needed now is for the government to take action and develop a new alcohol strategy so that we can drive down the increasing and unacceptable cost of alcohol harm. Matt Lambard, the Chief Executive of Portman Group, which represents the alcohol industry in the UK, said the ISS have failed to take into account the significant direct economic contribution to the alcohol industry or the wider economic and social benefits of moderate and responsible alcohol consumption in society. And I made the point right at the start, guys, that without a shadow of a doubt, the cost of living crisis, austerity, has played a significant factor in the increase of alcohol consumption. And I have made that very point. We fully recognise the impact that alcohol misuse has on health, social and police service, which is why the industry remains committed to promoting moderate drinking and supporting partnerships which tackle harm at a local level, including antisocial behaviour and underage drinking, he said. It is also important to remember that such an increased majority in UK drink responsibility harms such as binge drinking, alcohol-related crimes and drink driving has fallen significantly over the last decade. The Department of Health and Social Care spokesperson said, through our 10-year drug strategy supported by £532 million, we are helping up to 54,500 more people receive alcohol and drug support. We're also funding specialist alcohol teams in hospitals in England with the highest rates of alcohol harm and social economic deprivation. Last August, the government also introduced reforms to alcohol duty, meaning products are taxed directly in proportion to their alcohol content, and we are reviewing the official cost of alcohol harm estimated to support us in our efforts to address the harms associated with alcohol. So here it is again, government saying that we've invested this amount, and again, where are we seeing? Why are we not seeing the effects of it then? More needs to be more done in terms of help and whatnot. I don't think I don't think just increasing the pricing is just going to fix the issue. Like for me, I think it should be more. I really think they should make it more difficult for people to buy alcohol outside the pubs, like shops and supermarkets. Like I really, really do. I think it should be extremely difficult to buy it. And I think it should be much cheaper to buy them in pubs and restaurants and bars, because at least then you're contributing to the economy as well. But yeah, the health factor is obviously a major issue. And it's very important again to recognise that the crisis that the UK, that England is in as a result of actions being taken by the Conservative government over the last 14 years as well. So that must also play a factor into all of this as well. But it is a problem that needs to be addressed, and just raising prices is not going to fix the issue. If people want to steal alcohol in shops and supermarkets, they're going to try and steal alcohol. They're going to find ways to do it. So increasing the prices isn't just going to fix the issue. And there needs to be more programs to help people, and there needs to be more help from a social aspect of this, and not just a case of just shouting down at people who drink. So, yeah. But what do you guys think? What do you guys make of the alcohol abuse costing £27 billion a year in England alone? What do you guys make of the situation, the damage that is causing? Is it just a case of, people turning to drink more? Do you think that the cost of living crisis and on 14 years of austerity have had an impact on this as well? Is this just also a traditional thing that people are just used to drinking as well? What do you guys think some of the solutions that should be done to help tackle this issue? Let me know your thoughts and more in the comment section down below. If you found this video informative, please hit the like button. We greatly appreciate it. Share this across social media so others are notified of this video, and subscribe, because it really does help support the channel. And if you want to go one step further, financially support me and the work that I do here, you can do so by becoming a YouTube member for as little as 99p, or join me on Rumble, Facebook, or Patreon for exclusive content on those platforms. Thank you all so much for watching. I hope to catch you all very, very soon.